ಮಳೆ ಹನಿಗಳಲ್ಲಿ ಆ ಕಾಡುವ ಕ್ಷಣಗಳಲ್ಲಿ ಕೇಳುತ್ತ ಗುನುಗುನಿಸುತ್ತ ನಮ್ಮನೆ ಮರೆಯುವೆವು ಹಾಡಿನಲ್ಲಿ
ಮಾತಲ್ಲಿ ನೆನಪಿನಲ್ಲಿ ನಿಶ್ಶಬ್ದದ ರಾತ್ರಿಯಲ್ಲಿ ಕರೆದೊಯ್ಯುವೆವು ನಿಮ್ಮನ ಜೊತೆಯಲ್ಲಿ ಹೊಸ ಯುಗ ಯಾತ್ರೆಯಲ್ಲಿ
ಹುಡುಕುತ್ತ ಹೀಗೆ ದಿನ ದಿನವೂ ಹೊಸ ರಾಗದ ಲಹರಿ
ಇದು ಸಂಗೀತದ ಸವಾರಿ
ಆಕಾಶವಾಣಿ FM ರೇನ್ಬೋ ಆಕಾಶವಾಣಿ FM ರೇನ್ಬೋ
Akashvani FM Rainbow 101.3 megahertz. Musically yours.
Well, it's 3 minutes past 6. You're listening to FM Rainbow 101.3, and this is the Health Hour on this beautiful Tuesday evening. It's September 22nd, and this is the only exclusive health show on the radio. And of course, this September we have featured psychologists from various aspects, and this whole month we have specialized in reflecting on depression, children mental health, and so on. And so today it's very special because today we are dealing with various psychological issues related to the men. Yes, that's right. Well, to address this, we have a special guest on the show. We have Mr. Anoop Alex, who is a consultant psychologist and a psychotherapist. Mr. Anoop, a very warm welcome to you. Thanks for joining us.
Thank you, Raj.
So today we are dealing with the psychological issues related with men.
Right.
So psychologically, as a psychologist, how would you define the modern Indian men's psychology?
Just because I'm a psychologist, Raj, I don't think I dare to define Indian man right now. Because the Indian man is going through a lot of transitions. And if you look at the family system, it has changed from a joint family to nuclear families. And there's a lot of differences in the expectations the society and people have about men. In the past, men were not really part of cooking, taking care of children. But today we are. So all these changes that we go through in the domestic terms, as well as media, fashion,
Right.
sometimes it confuses us. Don't you think we are supposed to be equipped to appear better, to get a girlfriend?
Right.
So many expectations. So sometimes people do get confused, and it is natural for men to have this confusion right now. Hence, I would say that men are going through a stage of transition in India.
Absolutely. And as an experienced psychologist, what are the most common psychological issues that you find among Indian men?
I see that there are quite a few men reporting with anxiety, depression, substance abuse like smoking, drinking, having drugs, sexual dysfunctions, and relationship issues, along with high levels of stress. These are the common illnesses that we see, difficulties faced by men.
Right. Well, with that information, it's 5 minutes past 6. We'll be right back on FM Rainbow 101.3. You're listening to Health Hour, and today we are dealing with men's psychological issues. And we have Mr. Anoop Alex, who is a consultant psychologist and psychotherapist. If you have any questions, you know what to do. Pull out your cell phone, go to message screen, type in BGRB space your question space your name, and send it to 56060. That's 56060. Coming up next, we have a song from Doom 2. Well, that's right. Keep up the spirit. Welcome back. It's 10 minutes past 6. You're listening to FM Rainbow 101.3. And I'm your host, Raj Gunashekhar. Today on the show, we have Mr. Anoop Alex, who is a consultant psychologist and psychotherapist. And today we are dealing with men's psychological issues. Mr. Anoop, now we're speaking about psychologically stronger. Who are psychologically stronger, men or the women?
What do you think, Raj? I'm quite curious too.
I would say yes, men are very stronger.
Right. What happens when you go back home?
The women is more stronger.
Okay, all right. So to say precisely, what does strength mean? Is it absence of illness or presence of certain qualities? If you're talking about absence of illness, men and women are separately prone to certain psychological difficulties. For example, women tend to report anxiety, depression more often than men. And it is noticed that men come with learning disability, autism, schizophrenia, etc. more often compared to women. But there are no specific gender differences. To conclude, individual differences in resilience, optimism, capacity for good personal relationships, which are not gender specific, can play a huge role in mental health.
Absolutely. And also, tell us about the common myths held about men's psychology.
I think the most popular one is men don't cry. It's a sign of weakness. And they think that, like you asked, who is stronger? Men are emotionally stronger. Then they think that men think about sex all the time. Another myth. And many times, if you notice, men, when they get into relationship, marriage, they seem to get anxious about sexual performance, and it affects them sometimes. And there's another one which is quite serious. Many times people think men perpetrate violence more often than women. Again, I would recommend that we do believe that violence is an act of communication. Some people tend to communicate through violence, be it man or woman. Sometimes the damage done by a man's action tend to be more intense. Hence, the focus turns on to man. But men do report abuse, violence from other people, be it women or men.
Right. So those were the common myths about men's psychological issues. Great. And also, today we are living in the Silicon Valley of India, IT city, and many professionals are in the industry are experiencing so much of stress. So how does this affect one's mental health?
It is noticed that continuous stress over a period of time can change the composition of brain. And over a period of time, people can develop both physical and mental illnesses. For example, sleep problems, gastritis, hypertension, and in the long term, it may lead to obesity, diabetes, cardiac problems. When we come to psychological difficulties, people often complain about difficulty to maintain attention and concentration, and memory lapses, and mood disorders can be developed as a result of stress over a period of time.
Right. And what are the possible solutions for this then?
It is important that they do take help if they think that they're going through some difficulty because of stress. I would say that regular exercise for both body and mind, and to maintain a healthy and functional relationships and support system over a period of time. Have some hobbies, interests, communicate your emotions through words. That's very important, be it writing, talking, through art. It can be anything. And personal qualities like assertiveness, self-awareness, all this can help a person to be more healthy, even with stress.
Right. Well, 6:13, which means a lot of time for your questions. So you know what to type in BGRB on your cell phone. BGRB space your questions, space your name, and shoot it to 56060. Today we are dealing with men's psychological issues, and Mr. Anoop Alex, who's a consultant psychologist and psychotherapist, is on the show. Coming up next, ABCD, which is Anybody Can Dance. Well, 18 minutes past 6, you're listening to FM Rainbow 101.3, and this is the Health Hour. On the show, we have Mr. Anoop Alex, who's a consultant psychologist and psychotherapist, and today we are dealing with men's psychological issues. Mr. Anoop, now we're speaking about anger. So do men have more tendency to be angry?
What do you think, Raj, again? Because I think all people can be angry, and it's very natural for people to be angry, but expression of anger can vary with individuals, and sometimes expression of anger can be devastating, or it can be destructive sometimes. So we need to focus on the expression of anger more than the emotion itself. It is quite natural to be angry, feel angry when you want to, it's okay, but learn how to express appropriately. So the second point is how to identify, right? So many a times we see that people who do not know how to express their anger tend to hurt other people and themselves through withdrawal or distancing. It can be displacement of their emotions onto somebody else, like shouting at you. If somebody shouts at you, it means that they don't know how to handle their feeling of being angry. Sometimes people can find themselves being in difficult situations in relationships because they don't know how to express anger. And just imagine, just being angry and not knowing how to express, it can create a lot of stress for a person. So if you are a person who needs help, do take it.
So how do we manage this anger now?
Now, primarily, if you can't handle it by yourself, and if you're finding it difficult to manage, I would recommend that you take psychotherapy or counseling and find somebody qualified, a professional, to go through this process. And through that process, we help individual to understand where does anger come from and how to express and manage appropriately.
Right. And this question may be a little controversial because men are usually branded as very lazy or procrastinators. So how far is this true?
I'm just thinking, all the men who are successful, what will they be thinking when you ask that, right? So I think calling somebody lazy is a judgment, because sometimes people lack interest in doing certain things. It can be a symptom of depression, lack of interest in doing things. So we need to understand the source of the so-called laziness. Going on to procrastination is a tendency to postpone certain goals for a later period of time, and there could be various reasons for that. One could be they don't know how to plan, they do not know how to manage time. It could also be that they want everything to be perfect, whatever they do, such that they don't know how to use their resources appropriately within the given limits. So sometimes they tend to delay their goals because of that. So we need to look at the causes and address them in psychotherapy or counseling.
Rather than being judgmental.
Yes, rather than being judgmental.
Right. And men also are more inclined towards gadgets and technology, and especially they love video games that are a little violent, shooting and killing people. So will this create a very violent personality in men?
Right. So to answer that question, psychologists do a lot of research on various aspects of human mind and behavior. And we have found that, as psychologists have found that, constant or consistent exposure to violent media, be it cinema or video game, can create certain behavior to be aggressive. For example, if I take an example, a teenager who's watching a lot of aggressive films and engaging in games, he's learning from it. He's imitating it certain times. Whenever there is a situation where he doesn't know how to react, he may be prone to react in an aggressive manner, just because that is what is running in his mind all the time. So we do recommend that people learn to set certain limitations when it comes to violent games and movies. And to answer the second part of your question, Raj, I don't think games can make a person a criminal or a killer. There are certain factors from various backgrounds, like genetic, environmental, and psychological, that leads a person to be a criminal or a killer. So we shouldn't blame on games. So there's much more to that.
Right. And there's a question coming in from Venkatesh Babu, who's asking that, he says that he had a seizures while taking a morning walk one day last month.
Okay.
And is it because of the exercise stress, he's asking?
Okay, there are certain types of seizures that can be caused by stress or various other neurological factors. So I would recommend that he meets a neurologist or a psychiatrist first. And if they say there is no physiological cause for his symptom of having a seizure, I would recommend that then later he meets a psychologist for counseling or psychotherapy.
Right. And the next question is coming from Giriraj, who is asking, can alcohol cause stress in men?
What do you think, Raj? How is your neighbors? Do they drink? Do you hear anything?
I would say alcohol is naturally very bad for the health. So yes, it causes stress.
Okay. Yes, it does cause stress in family, in relationships, and if you're excessively dependent on that. And sometimes people use alcohol to convey their emotions. You've seen people crying after drinking. It's just that makes the person a little bit resistant to their usual ways of defending themselves, their emotions. So yes, over a period of time, it can cause stress and various other difficulties for a person if you're addicted, if you're dependent on alcohol.
That's very interesting. Well, 6:24, you're listening to 101.3 FM Rainbow, and we have Mr. Anoop Alex, who's a consultant psychologist and psychotherapist, and today we are discussing men's psychological issues. If you have any questions, it's the same statement. BGRB space your question, space your name, and send it to 56060. That's 56060. Coming up next, Cocktail. In the voice of Sunidhi Chauhan. What a beautiful number, isn't it? Welcome back. You're listening to FM Rainbow 101.3. Time is exactly almost close to 6:30, but 6:29 exactly. Welcome back, and you're listening to 101.3, and my name is Raj Gunashekar. On the show, we have Mr. Anoop Alex, who's a consultant psychologist and psychotherapist, and we are dealing with men's psychological issues. And Mr. Anoop, now speaking about insecurity, are Indian men more insecure than men in other countries?
Oh, Raj, your questions. You see, I would say that be it any individual. It really depends on their personality, their life. That's the sole reason for the insecurity, not cultural factors always. So I won't make such generalizations saying that Indian men are more secure or not, because it really depends on the individual you are, be it a man or a woman.
Right. And also, are women more susceptible to depression clinically?
We have found that women report occurrences of depression or anxiety more often compared to men, and doesn't mean that men doesn't have depression or they don't report. They do report, but sometimes, as I told earlier, men tend to think that reporting depression is a sign of weakness, because they think that they're supposed to be stronger mentally and have no such illness. So, but if you notice, when we look at suicide, because we're talking about depression, many times we tend to talk about depression in context of suicide because we see a lot of news about suicide online or on paper. We see that people who are single, especially men who are single and in their 40s, and if they're unemployed, there's a high chance of committing suicide. And many times men are successful in committing suicide because they seek extreme measures to kill themselves. But I have found that many times men do not present with the usual symptoms of depression. Sometimes they may not be sad always. It could be being angry always. It could be lack of motivation. It could be low self-esteem. It could be withdrawing. This could be the symptoms of depression in men compared to being crying or having fainting spells or anything of the sort. So, not so dramatic as you would expect it to be.
Right. And also now, speaking about addictions, men tend to be addicted to a lot of drugs, alcohol, excessive entertainment, or even sex at times. So how to deal with them?
You said entertainment, Raj. Is addiction entertainment?
When it is excess, I think so, yeah.
Right. Who will complain about having excessive sex?
I'm not sure.
Right. So my point is that sometimes addiction, when we talk about addiction, be it any substance, be it drug, sex, alcohol, any substance, it becomes, we call them being dependent on that substance only if it is affecting their performance and if it is making them dysfunctional in certain areas of their life. If they're not able to fulfill certain responsibilities that they, and if it is disturbing for the family or people related to them, then also we need to look at that behavior as not being effective or healthy. So there are quite a few self-help groups like Alcoholics Anonymous, Narcotic Anonymous, which we found that being very successful in helping people to come out of addiction and sustaining abstinence. We also provide medical, psychological, and rehabilitation procedures to help people to manage addiction.
Right. And also now speaking about men who have undergone a lot of abuse, be it physical, mental, emotional, verbal, or even sexual. So what kind of symptoms show up in their adulthood and how do we deal with them?
It's quite saddening to see how a life can be affected by something happened in the childhood, be it trauma, be it abuse, be it loss of someone. It does affect people. And we notice that people who have gone through trauma or abuse report poor interpersonal relationships or difficulty in maintaining them, along with mood swings, anxiety, depression, anger issues, sometimes substance abuse, and they do need help, and they can be helped through psychotherapy, counseling, and sometimes if they present with some other illnesses, then they would need medications. But generally, I would recommend psychotherapy as a mode to help people effectively.
Right. And we have a question coming from Dilip who's asking how do we psychologically deal with mental tensions, torture, and worries?
I think we are going to answer that question again in soon, because I want to talk about how to stay healthy. So shall we answer right now, Raj, or we'll
Actually,
talk about
you
later?
can answer it in short.
Yeah. So primarily, you need to do regular exercise for being healthy, both physically and mentally. You need to have relationships, stable, healthy relationships, people who can help you. You need to maintain a routine and have a life that is generally healthy for you. So these factors help you to be healthy. And of course, expressing your emotions verbally is a huge success when it comes to being healthy.
And we also have another question coming from Gopal Krishna, who's asking, his wife is schizophrenic, 58 years old, and she's 58, but she refuses to take medicines.
Okay.
So how do we deal with such a person, he's asking?
People who go through schizophrenia, it is never easy for them. It's never easy for the families. They find it very difficult to seek help, to manage the illness, because it's an ongoing disease. It can last for years. And when any person has schizophrenia, I would recommend that they take the patient to a hospital, maybe like NIMHANS. And if the patient is not willing to seek help, there are certain professionals who come home and treat. There are certain social organizations like NGOs who does help people with mental illnesses who's not ready to take help. So I would recommend that he talks to a professional psychiatrist or a psychologist and learn how to manage this illness that his wife is going through, because we provide psycho education for the family to help them understand how they can manage and be with individuals who are having schizophrenia or any other psychotic illnesses.
Right. And also the number of dengue cases in the city is on the rise. So how do people cope psychologically with dengue at the moment?
Right. So even though it's not related to psychological aspects, I would say that there's a lot of time free when you're having any physical illness. Use that time appropriately. And if you have pain, focusing on the pain a lot will not help you. Engaging yourself in some kind of interest or hobbies. Maintain your relationship with other people. Just because you're ill doesn't mean you can't talk. So talk to your friends. Use this time to build up relationships. And maybe this is the time you can write a book. You never know.
Wow.
So there are so many things, you can do when you're ill.
Absolutely.
So have hope. Get well soon.
Absolutely. Well, along with that, make sure that there are no stagnant water around your home, and also make sure you use good mosquito nets to protect yourself from dengue. Well, on that note, if you have any questions, type in BGRB space your question space your name and shoot it to 56060. Today we are dealing with men's psychological issues, and we have Mr. Anoop Alex, who is a consultant psychologist and psychotherapist, coming up next. Dostana. Well, last 20 minutes left on the show, 6:40. You're listening to FM Rainbow 101.3. On the show, we have Mr. Anoop Alex, who's a consultant psychologist and psychotherapist, and today we are dealing with men's psychological issues. Mr. Anoop, now speaking about mental illnesses. So how do people exactly perceive mental illnesses?
It's interesting, Raj, because I just realized I made an error while speaking. Because many a times people think that exaggerated symptoms, they care only for the exaggerated symptoms. They think if a person is, like I said, depressed, people doesn't really faint. They don't really do any drama. But we think that only when people exaggerate their illness, we take them for proper help. And that's because there's a stigma associated with mental illnesses. People think that it's wrong to be ill. People think that it is a character that is not right of the person. It can be so many other psychological difficulties a person goes through. So we need to understand, we need education about mental health, and we need proper media for that. The newspapers, like you are doing, Raj, radio, TV, we need a lot of more information to be provided to our society.
Right. And also now, speaking about men who grow up in dysfunctional families, do they tend to become more oriented towards the same gender? And on similar lines, we have a question coming in from a listener who's asking, what is the role of psychology in a homosexual individual?
According to psychologists, homosexuality is a natural sexual orientation, and we do not perceive it as an illness. So there need not be any pathology behind it. And to talk about the factors behind a person developing or having homosexuality, it's a complex interplay of genetic, environmental, psychological factors, and it's very difficult to differentiate between these. Okay, and primarily you need to understand that homosexuality is a natural sexual orientation. It need not be treated. But sometimes people with homosexual nature, they find themselves being confused. going through a lot of stress because their family, the society wants different things from them.
That's right.
When they go into such a conflict or difficulty, we help them to accept themselves and come in terms with their sexual orientation. That is what we do. So there is no universally accepted psychological account for homosexuality.
Okay. So essentially, there are no psychological treatments for homosexual individuals.
But some psychological factors can affect one person's perception of homosexuality. For example, if a person is realizing that he has certain homosexual or bisexual tendencies, the realization itself can be daunting for that person, especially in our society. And that needs to be addressed.
So psychologically, it's not possible to change their orientation, or how is that?
In the past, people meaning professionals used to follow conversion therapies based on the principles of reward and punishment. But nowadays, we see them as unethical and we do not practice that anymore. So like I said earlier, it is not an illness. It need not be treated. But we do provide help with self-acceptance, managing social stigma, and choices about lifestyle.
And we have a question coming in from number ending with 2236 who's asking, why do men experience sudden mood swings all the time?
Any person can experience mood swings because of various factors. So like I discussed earlier, there is no particular reason for a person to go through illness, but any illness or even a symptom like mood swing. So if our listener is going through a mood swings consistently, persistently over a period of time, I would recommend that he meets a professional psychologist or a psychiatrist and seek help. And for him to understand, he will have to meet someone. So let's hope that he meets somebody soon.
Right. And also we have a question coming in from Kavita who's asking, can menopause lead to depression and introverted personality?
It is noticed that the hormonal changes a person goes through when she's having menopause can cause depression sometimes, along with mood swings and certain physical difficulties. So if our listener is going through unmanageable difficulties, again, let's hope that she meets a professional soon. But it's natural. It's natural to have both psychological and physical difficulties when you're going through menopause.
We have a question coming in from Prakash who's asking, in the previous segment we were talking about violent games. So his question is dealing with violent games. He's asking, why do you think violent games are very popular among people?
Just think about it, Raj. If you're walking on a road and somebody is talking about how nice this world and how love is important, how much attention do you really pay? But just imagine, if somebody is talking about being aggressive, hurting someone, we do pay attention. It means that it creates a sense of excitement. That is why we like action movies. That is why we like bullfights. That is why we like people boxing. So it creates aggression. It's all about excitement sometimes, as much as it hurts people.
And also now, speaking about comfort food addiction, how can men get rid of it?
Many people often eat because they don't have any other soothing mechanisms. Some people eat to soothe themselves, especially if they're going through stress. People tend to relax themselves by eating. And if it is becoming unmanageable, they need to understand why they are eating a lot and why they are dependent on certain food. And if it is unmanageable, again, if they're not able to manage it, take help. They need to take help.
And also, some men tend to suffer from absent-mindedness. So how do we deal with it? And Suresh is also asking a similar question. He keeps forgetting what happened yesterday or a few days ago. So is there any solution he's asking?
When we talk about absent-mindedness, is it getting lost in thoughts? Is it being not able to attend to certain instances? Or is it memory lapses? Because all these three symptoms are different, and depending on age, we assess them for anxiety, depression, or dementia. So if it is persistent, if it is there for a long period, I would recommend again that he needs to meet a professional psychiatrist first.
Right. Well, 6:47, last few minutes left on the show. If you have any questions to Mr. Anoop Alex, who's a psychologist and psychotherapist, type in BGRB, BG as in Bangalore, RB as in Rainbow. BGRB, space your question, space your name, and send it to 56060. That's 56060. Welcome back, 6:52. You're listening to FM Rainbow 101.3 and this is Health Hour. Today we are dealing with men's psychological issues and we have Mr. Anoop Alex, who's a psychologist and psychotherapist, and a lot of questions are pouring in the system. Mr. Anoop, now speaking about people suffering from attention deficit disorder, how do we help those men?
We help them with medication, psychotherapy, and cognitive retraining, and we teach them mindfulness. Being mindful can be quite helpful for many people. Like you asked earlier, people with memory lapses and attention difficulties. Learning and practicing mindfulness is a good way to do that. But if you're not able to handle by yourself, go through a professional, take up medication, psychotherapy, and if necessary, cognitive retraining.
So what would be the tip for absent-mindedness men?
So, like I said, mindfulness is important. Having a plan, keeping a plan about their activities, keeping a note about their goals, all this can be helpful.
And today a lot of men deal with a lot of breakups. So how do we help them?
Breakup is a loss. Be it death, breakup, a person is losing somebody valuable to them, even if it is not so valuable. If the person is not so, but still they're going through a loss. They would feel a void in their life suddenly. They need to allow themselves to go through a normal grieving process. That means they need to understand, experience, and move on from the emotions they're going through, state they're going through. Going further, it will be also wise to avoid rebounds, that is getting into another relationship immediately without resolving the emotions from the previous one. Or another thing could be addiction. You need to avoid getting into those activities.
And also some men tend to be caught up in the wrong jobs or pursuing the wrong courses because they were forced to do so, and they feel very lost. So how do we help them?
So feeling lost, feeling stuck, all this means that that person lacks a sense of meaningfulness or purpose in life. So in order to help them find meaning in life or purposefulness in life or their work, we need to help them understand what do they want, what do they need in their career. And sometimes it could be career change, it could be a role change, or it could be the organization that they need to change to come out of it.
And there's a question coming in from Govind Bhatt, who's asking, is short-temperedness a psychological disorder?
Right. So short-temperedness is not a psychological disorder. It is just a personality trait. But if you are not able to manage it, if it is becoming too difficult for you to manage, then take up help and go through that process of counseling or psychotherapy, because that will help you learn how to express your emotions even if you have short temper. Just the fact that I can tell you, Raj, I'm angry with you and I am not able to handle myself, I need some time off, I am not in a position to talk, that can help you manage that particular situation. So let's hope our listener learns how to manage.
And also we have a question coming in from number ending with 7990. The lady is asking or is saying that her husband takes every smallest little things very seriously and gets easily angered. So how do we deal with it?
We talked about perfectionism earlier. Sometimes certain individuals want to make everything secure, planned according to the plan, and they can't break away from the plan. They find it difficult to be flexible. So in order to deal with this, if the husband is not able to gain any insight from the talks she's having, let them go through couple therapy, couple counseling, and figure out certain ways to manage it.
And another question is coming in from 3325, who's asking, do obese people need to consult a psychiatrist?
Only if they are bothered by it.
Otherwise they don't have to.
No.
Okay, all right. And also there's one more question coming in from a person number ending with 7955, who says that men tend to have more defensive attitude and not ready to take responsibility. So how do we deal with that?
It is a sense of pride. Some people do not take criticisms due to pride. So again, like I said, that is part of it's an emotional skill. It's a skill that you need to develop to take up criticisms. So if you're not able to handle it, take up help.
Absolutely. And so it's almost like 6:57 now, Mr. Anoop. So what would be your concluding remarks to all our listeners out there?
So I want to give 5 tips. First one, express your emotions, learn from it, experience it fully. Nothing shameful is going to come out of it. You can express. Second, regular exercise both for your body and mind. Have supportive relationships. And enjoy your life, have some interesting hobbies, grow through that. The last one would be, as any living being, you need to upgrade and update yourself throughout your life. And finally, know when to seek help. If you need help, take it up.
Well said, Mr. Anoop Alex. Thank you very much for joining us. We
Thank
appreciate
you.
your presence here.
Thank you.
Thank
Thank
you
you,
so
Raj.
much.
And it's been good talking to you.
Same here. Thank you so much,
Thank
sir.
you.
Well, 6:58, it's time for me to say goodbye, but I'll be right back on Media at 7:02 right after the news in Canada. So I'm leaving you with this amazing song which I interrupted in between. Anyway, have fun. This is Raj Guneshekar signing off for now.